Hi, everyone. Good morning, and thank you so much for taking time this morning to be part of this presentation. This is Julie Johnson. I'm Public Health Preparedness Consultant for the Southwest region. I work out of the Marshall office and part of the Emergency Preparedness and Response Division at Minnesota Department of Health. I'm also working with Nancy Carlson to the Disaster Behavioral Health portion of Emergency Preparedness and Response. Nancy, go ahead and introduce yourself to the group.
Hi, I'm Nancy Carlson. I do disaster behavioral health in our Center for Emergency Preparedness and Response, and I'm excited that you've invited us here to talk to you guys about stress within the public health system during COVID-19. Today we're going to, Julie's going to give you our objectives real quick. I know we still have some people because I see some things popping up from word of people moving into WebEx. So
I think we will continue on with the presentation there this morning. There are a few individuals that are still logging on, but because the time is limited, we'll move forward here. And so the objectives for today, again, this is Julie Johnson. Discover the emotional stages of a pandemic and how they shape beliefs and behaviors. Understand your risk for compassion fatigue and steps to take to reduce that risk. Learn about moral injury and how to protect yourself. Experience a brief informal peer support sessions. Those will be our polling sessions. Gain tools and resources to aid stress monitoring and management. And Nancy will share several resources at the end of the presentation. All right, I'm assuming so, and apologize for all the technical difficulties today. Nancy, are you able to speak to the slide? No, okay. I'm going to move forward with this. So Nancy typically takes the first part of this session, but we're going to move forward here. So compassion fatigue is a combination of burnout and secondary stress. Burnout is a result of the work that many local public health, tribal health, MDH staff are doing as a response to COVID-19. It can include organizational stressors, expectations of what is required from our assignments, and in the response, different and or longer hours that are worked. These are all components of burnout. Secondary traumatic stress is the result of hearing trauma from another person. Working in this response, you hear the personal stories, the challenges from individuals, and many times cannot provide the answer they want or need. You may also have been emotionally impacted by the recent shooting of George Floyd, natural disasters, and other traumatic events. And because you care, it can be difficult to just ignore your emotional reactions and just brush them off. Burnout plus secondary traumatic stress equals compassion fatigue. When you experience burnout, a symptom of compassion fatigue, you may have some of the following feelings: as if nothing you can do will help, tired, even exhausted and overwhelmed, like a failure, as though you're not doing your job well, frustrated, cynical, disconnected from others, lacking feeling, indifferent, depressed, using alcohol or other mind-altering substance to cope. Signs of secondary stress: fear in situations that others would not think. We're frightening. Excessive worry that something bad will happen to you, your loved ones, or your colleagues. Easily startled, feeling jumpy or on the guard all of the time. Weary of every situation, expecting a traumatic outcome. Physical signs could be a racing heart, shortness of breath, and increased tension, headaches, sense of being haunted by the troubles you see and hear from others, and not being able to make them go away. The feeling that other trauma is yours. The roles and boundaries in self-care. Healthy boundaries are a critical component of self-care. That's because in work or in our personal relationships, poor boundaries lead to anger and burnout, resentment. And so, setting boundaries is hard. We worry about the feelings of others. Self-care means taking personal responsibility for your health. Self-care requires you to set boundaries, both physical and emotional. A lot of times when we think about boundaries and work, for example, I typically work from 7:30 a.m. to 3:30 p.m. Sometimes the COVID response requires me to work a little bit longer hours. And so you have to kind of figure out a balance of what our work schedule is as well as our personal life. Think about how you can maybe take on more today, but maybe say, in a couple days it's more of, I'm not feeling up to taking on that responsibility. Maybe someone else can help me with that, or it can be delayed. So those boundaries, and also, identifying the framework of how we can deal with that, a good balance. Boundaries help us manage stress. An example is when you say no to work overtime, you're prioritizing the need for rest. Putting your needs first reduces anger, anxiety, resentment that increases our stress level, as the slide depicts. And to continue to be able to help others, be a good employee, and take care of yourself, family, while keeping yourself healthy, you have the ability to set boundaries. Next slide, please. Nancy, are you on?
I am on. Can you hear me now? For some reason, my mic was not working. I kept going, I'm here. It's been one of those days, people, where we're talking about stress and we're building it up. So now we want to kind of do a discussion on what are some examples of healthy self-care to avoid burnout. So if people can put some, ideas of what they do to take care of themselves in the chat, we would greatly appreciate it.
Nicole says yoga. Amanda says walking. Caroline says pets. Amanda said Qigong meditation. Emily says having clear boundaries between work time and non-work time. Hillary said taking lunch. I set a timer so I don't have to keep checking the clock. Stefan says exercise, stretching, family board games, playing with kids. Celine says cuddles with my dog. Chuck says exercise. Jim says love daily walks with my spouse and dog. So Chris says spending time with family. Jory says painting, art. Krista says family time, getting outside, and everything that is also being mentioned. Stefan says singing. Catherine says non-work reading materials. Thank you all for posting these things. It's good to hear ideas of what other people have.
And we're going to move forward in the for time because we are running a little bit late, but continue to put ideas inside the chat, and we will share them as we move on. The other thing that we really wanted to address, aside from staff dealing with burnout and and secondary trauma and compassion fatigue. We also have staff that are dealing with moral injury. And this is a relatively new impact upon public health workers. We see it a lot inside situations with maybe activists or military members who are faced with are exposed to things where they can't step in to do something, to protect somebody, or where they're witnessing things that are against their personal moral values. But we're seeing it here a lot during COVID in healthcare workers and public health workers. And really, moral injury is an affliction of conscience. It happens when there's a high-stake situation where there's not really a good choice. Emergency decisions have to be made rapidly, mainly by instinct. I mean, we're trying to collect data, to make all of our decisions as we do in public health based on data, but we don't have the firmness, and how we're collecting data has changed throughout this, and it's not work as normal for public health. And what it is it really includes these feelings of maybe betrayal and anger towards leadership, either within MDH or also within our political leaders and, community leaders. It's not a mental health diagnosis per se, but it is really what we call a psychological wound. It's a traumatic stressor that if we don't address it, if we don't recognize it, can really lead to developing a post-traumatic stress disorder down the line. And what we're seeing here for public health during this is, we've seen in unprecedented numbers public health leaders across the nation leaving their positions because they've been verbally attacked, physically attacked, threatened. Not just public health, but some of our governors too. I mean, in different states, attacked because of the decisions they're making to try to protect the public. It's become such a huge issue that actually back in June, the Public Health Institute put out an announcement that when the truth becomes a threat, that they were standing in support of public health officials. Now, moral injury, there is an assessment tool that if you want to check this and see how you're doing, it's a reliable and valid screening tool to assess symptoms in healthcare workers. And it's a 10-item scan. And it really looks at the symptoms of betrayal. So think about this if you're feeling any of these. Betrayal, guilt, shame, moral concerns, maybe religious struggles, loss of religious or spiritual faith, loss of meaning, purpose, difficulty forgiving, loss of trust, or self-condemnation. If you're feeling any of these in response to your work in COVID. So I want you to just be, really aware of this, as this is a threat. Next slide. So what are some of the self-care strategies? Because self-care really is another thing that we're pushing a lot through this training, because it has the potential to reduce your exposure to burnout, secondary trauma, compassion fatigue, but also moral injury. And really what the recommended for dealing with moral injury and reducing that impact is to really seek out others and to talk. We're going to talk a little bit more, I'll give you some information on it later too, about the buddy system, but to really develop a way where you support each other, either within your division, within units, between friends that you work with, coworkers, to really talk about the things that bother you. Just even talking it out and talking about how you should, the reactions to it and why things are happening reduces that stress. We also need to pay attention, and this goes for any stress level that we have, really start to listen to how we talk to ourselves. Our self-talk has always been a trigger in increasing or reducing our stress levels. We need to start turning those I should have, or I could have, or I would have, into I did the best that I could at that time, with the knowledge and experience that I had at that time. And just accept that, and don't look back on how you could have done things different. We always could do things better in retrospect. We need to just focus, especially during a disaster and a crisis, something that moving as quickly as this, and especially during this time where it's growing, we need to just do the best that we can at that time when we're doing it. And we also need to take satisfaction and pride and gratitude in what we have accomplished, even the small things. And most importantly, we need to learn to be patient and kind with ourselves. You know, so many people treat other people so much better than they treat themselves. Their expectations for other people are so much lower than they are for themselves. We need to start turning that around a bit and be understanding and caring about ourselves. Next slide, please. So what can we do? What other steps can we do to reduce the impact of compassion fatigue and moral injury? Well, first is to really understand the emotional impact of the disaster crisis situation that we're facing. We need to be aware of the potential for exposure to moral injury, and we are at high risk still of that. I mean, as things change, the governor is going to make an announcement again tonight about closing down some venues, and people are going to be upset with public health once again about those decisions. This is going to continue to happen throughout this. So be aware of how that impacts you emotionally. You need to monitor and recognize your stress and trauma exposure. Because if you don't recognize your stress level, then you're not encouraged to practice stress management and self-care, which is critical in taking care of yourself. We really want you to think about participating in a formal or informal peer support system, and want you to talk to a mental health professional if you need it. I mean, we think nothing about going to a doctor if we have an open wound and blood gushing off of us, but we can be in emotional pain and people around us can see it, and we ignore it. We ignore what's going on with others, we ignore what's going on with ourselves, and we need to change that. We need to stay strong, and we need to take care of ourselves so that we can do our jobs and take care of ourselves and our loved ones. Next slide, please. So part of what we want to gain from the training is an understanding of how we can also help you. We're going to talk about some of these things that I just talked about in the last slide as we go on with the training, but I also want you to say now how you think we can help you as we move forward to do this poll. You know, do you need some more education on self-care and stress management? Do you need more tools and resources? Is it that you've got enough of those, but you don't feel like you have enough support from MDH or your leadership? Or maybe you feel like you're really good and you've got this under control. So we're going to take a couple of minutes for you to fill out this poll.
I hope everybody's able to see the poll over on the right-hand side of the screen to be able to answer it. Okay, closing the poll and sharing the results.
Okay. It looks like we've got quite a mix of answers. The main thing that people seem to want is more support from our organization and leadership, 36 out of 65 people who answered the poll. There are also 19% that are looking at needing some more resources. 10% are interested in more education and training, and we actually have 11% that are saying that they were doing pretty good. Please feel free, as we move through this training and ideas come to you, to put anything inside the chat about different types of training that you might be interested in, different types of resources. We will be, like I said, going over some resources here at the end, and hopefully those of you that are looking at those will address yours. I'm going to turn this over to Julie to start talking about the incident command system.
Thanks, Nancy. Yes, this is Julie once again. And so we felt that it might be helpful for all just to kind of be reminded of the incident command system, which we at MDH are under at this time, of course, with the COVID response. And so you can see that this is a very simplified command system where we have the incident command, operations, planning, logistics, finance. But if you've taken a look at the incident command system structure that MDH has today, there are several different branches and different activities that are under each of these. And so we can also really think about why Incident Command is set up. Incident Command really has been in place after the 9/11 event, where, all felt that it is good to all have the same knowledge and the opportunity to really kind of respond in a framework that really is structured that we can fit the needs of the requests. And so with this COVID response, we have seen where, back in January, there was some activity, and then by March and April, our incident command structure just expanded. And there were so many needs that our resources were limited, and so additional staff was asked to come on to support the incident command structure. And with that, of course, we see a lot of stress with that because, again, the current COVID-19 response has increased expectations, increased the work with unfamiliar systems doing work that is not what we were hired for, maybe, or for an unknown amount of time, of course. This COVID response continues to move on, maybe with some answers, not a lot of answers. The vaccine planning is going on, and again, additional staff needed to help with that process and those tasks. Contact investigation, contact tracing, time intense, resource intense. And so, COVID-19 is different than any other response that we have dealt with in recent years. A tornado that goes through town, incident command structure is set up, and maybe the activation of that whole response happens within maybe 2 months or 3 months or 6 months, where, COVID continues, and there's really not an end date in mind at this time because of the activity and the information and resources that are needed to help with this response. Next slide, please. And so we looked at traditional view of emotional stages of a disaster, and as you can see, it may be familiar to many of you because it shows that it's traditional emotional stages of a disaster. But while it explains the initial reactions to COVID-19, pre-planning before the virus was seen in the United States, and when all hands were on deck, there were some heroic responses. People mostly complied with the stay-at-home order early on. And then we fell into disillusionment stage. It does not really explain the emotional roller coaster and device behavior that we are seeing with our friends, families, and with our communities today. Next slide, please. Then we also looked at crisis defined by grief and loss. As you can see on this slide, and also, thinking about how overwhelming this disaster has been defined by grief and loss. Everyone, regardless if they or a loved one has dealt directly with the virus, has suffered some type of loss. Loss, especially an unanticipated loss, creates significant emotional stress that shapes the thoughts and behaviors that people use to cope with their loss. On the left-hand side of this slide, you can see loss of loved ones, inability to see or hug loved ones because of this virus, inability to say goodbye to those who may died in a healthcare setting or while separated from family, inability to retrieve the body of timely burial or funeral rituals. COVID-19 has provided again, a lot of grief and loss, personal loss, control, income, privacy, valued civil liberties, trust in our government or in mankind, and spiritual beliefs or faith may also be defined here as well as a loss. And so next slide, please. Again, this might be more common to all of us with a classic grief cycle. This is the work of Elizabeth Kubler-Ross, the denial, anger, depression, bargaining, accepting. Again, similar to the stages of disaster, it only partially explains the reactions we are seeing during COVID-19. Next slide, please. So we're going to spend a little time really talking about emotional stages of a pandemic crisis. We feel that this is a better way to view COVID-19 and understanding that similar to the stages of grief, the emotional stages of a pandemic is not a linear process. You can jump stages. You can be in several stages at the same time. You can move back and forth along the continuum. Different people are at different stages in their reactions to COVID-19. So let's spend a little time kind of talking through some of these. Next slide, please. Denial is the first. The disharmony between what you believe and how you want to behave, such as the world with the COVID, restrictions, virus, the world as it was before COVID-19. Some people, through past experiences with crisis situations of flexible nature and or through an understanding of public health, are able to resolve their cognitive distances by accepting that things have changed and the world now has to practice some restrictions in order to get through this crisis. Others lean that their decisions and utilize a cognitive bias, a way of looking at situations by filtering it through a lens which fits with the preconceived opinions and personal perceptions of reality to retain their view of the real world before COVID-19. Again, COVID-19 is somewhere else, not here. The refusal to believe or acknowledge an experience or event. Cognitive dissonance is the main reason the person's concept of reality is so different from what is occurring. Denial is a defense mechanism that shields us from what can, as far as how much we can take in at one time. Next slide, please. So we spent a little time kind of talking about the cognitive bias and denial. Unfortunately, in groups, political groups, peer groups, spiritual, religious, faith groups, social media, that speaks out to denial of COVID-19, continue to strengthen confirmation bias. So on this slide, we talk about the normalcy bias. Everything will stay the same. Don't believe that COVID-19 exists. There is no reason to change my behavior. And I can really relate to this one because there are some communities in Southwest Minnesota that don't believe that, they don't believe COVID-19 exists, and it's something that's made up. And so there's no social distancing, there's no masking. Life goes on. Confirmation bias explains like preconceived opinions. In a political ploy, it will go away after November 5th. Well, today is November 18th, and we're still here, right? COVID-19 is just a myth started by the government to take control of people. Confirmation bias. Next slide, please. Nancy, you want to talk a little more or talk about rationalizing?
Rationalizing? Yes.
Thank
The
you.
next stage of rationalizing, and remember, you could be in denial and still rationalizing, So just to say these are not these linear steps that people go through. But there's a lot of people that are saying, okay, yes, COVID's real, but it's not that bad. We hear time and time again people saying, but not that many people die from it. So they're rationalizing that it's not that bad, so they can deny having to take, any steps or actions and rationalize that they don't have to change their behavior. They'll accept this part of it, but they're still having this defense mechanism coming up because they don't want to change their reality, and it has to change. It's the rationalizing and rational decision-making are not the same thing. You probably already know that, but I feel like I need to state this. During rational decision-making, we apply reason and values to a situation and decide the smart and right thing to do. That's what we do in public health. Based on the data, we do rational decision-making. And that changes because this disaster changes. That's a part of that our rational decision-making and the rules change and they move around is really hard for some people who are having trouble, that are still suffering from really strong cognitive dissonance and getting equilibrium going on inside their emotions and their thought processes. The changes are difficult for them. Rationalizations are because we've already decided what we want to do, or we've already done it. We're already going around without a mask, and we want to defend ourselves for why we're doing it. So we want to make sure that we come up with a reason that doesn't morally compromise how we believe. So we rationalize our thoughts. It's a defense mechanism, the same as denial, but it helps us to justify our behavior without disrupting our preconceived version of how we feel the world should work, and without having to really face that there's a potential life-saving, life-changing danger present. So cognitive bias is, once again, a major player in this rationalization process. So we're going to talk next about a little bit of the cognitive biases that we're seeing in people using rationalization. Next slide, please. Confirmation bias continues to be there, and we continue to see this spread, and it's one of the biggest things that we are fighting against as public health professionals, because we continue to have leaders that don't change how they talk about masking and social distancing. They're not role modeling behaviors, so they're continuing to keep that political agenda or that behavior doesn't change, that rationalization process going. What we also are seeing is an anchoring bias, and this is strongly seen by the people who talk about, you told us not to use masks to start with. In an anchoring bias, you tend to rely too heavily on early information or a piece of information to make decisions. And so people are rationalizing not using masks, using this anchoring bias about how we told them not to use masks to start with. Now, we did that because, for one thing, we didn't know that there was such a large number of people of asymptomatic, COVID positives that could spread this disease as strongly as they can and as fast as they can. Secondly, we didn't have the availability of masks that we have now, or the availability of people to make masks like they've been doing that we do now. And we were very concerned that the public would stockpile and hoard masks, much like they did with toilet paper and hand sanitizer and cleaning wipes, which I understand is starting again. I've seen in the news. People now are seeing the cases rising and are starting to do some of that behavior. So we said what we said at that time to protect our healthcare system. People are using that back against us to say masks don't work, to rationalize not wanting to wear a mask. Now, the discounting, this is where we see a lot of people that use that rationalization of not that many people die from it, or kids don't really get sick from it. The rationalization for that is not necessarily true, because we don't know long-term impacts of COVID-19, of the virus on health and how it's going to impact your health as you go on. We also don't know, we know that more and more youth, young people are getting the virus, and we also don't know what the impact on them will be as they move forward and they get older. Will they have more asthma? Will they have more trouble with heart disease? So people are using this discounting of, I'm not at lower risk. So it used to be, this is why we had the problem with parties, people having weddings, big weddings, people going to the bars, all of this type of stuff, is that young people, that 18 to 35 group that we were pushing to get tested, are the people that would go, I'm not at that, not many people in my age group are dying. So I want to go out with my friends and party, I miss doing that. So they rationalize their risk is lower than their desire to go have fun. Same with people with big weddings or big parties, family things. I really want this dream wedding, and I think the risk is low. So people are using these type of thought processes to rationalize their behavior. Next slide, please. But what we're also starting to see is, and we've seen this all along, is shock. People, you know, throughout the virus, throughout the months that we've had this, the family members and the people that have been directly impacted by COVID-19 have been shocked about how serious and how quickly this disease goes bad, and the hospital needs and the ICU care and the breathing and the you know, the consequences that last for as long as they do. There was recently an article in the paper too, and this goes back to Julie's comments about, we actually have communities in Minnesota who do not believe that COVID exists. So when they get diagnosed with it, and this nurse was talking about it, they refuse to believe that it's COVID. They demand a different explanation. They get angry with healthcare providers, or they're shocked when a loved one dies from it or actually becomes really sick from it. We've also seen shock when people's rationalization, their cognitive biases, run up against reality. You know, we've seen inside social media and on the news of individuals who have just lost it in stores where they've been asked to put on a mask. And those individuals will say later, when they've had a chance to calm down, that that's not them. That's not how they would normally react. But when you're when you're in denial, your rationalization is pushed up against a reality, then you can no longer keep that equilibrium of staying within your cognitive bias to provide you with that calm inside your emotions, and you explode. So this is why we're seeing some of that behavior that's out there. Is sometimes, you know, these type of cognitive biases are not necessarily helping individuals in processing things. Next slide. So I just talked about this. What happens when somebody is pushed up against a situation where they were told to be masked and they believe, they've listened to the confirmation bias out there of this is taking away their civil liberties, or they believe it's a political thing that's going on, or they feel that they don't work because they have, you know, a belief that we told them to start with. Their cognitive dissonance gets stronger. They can no longer deny it in that moment because everybody around them has a different reality. Their rationalization gets threatened, and so they act out. And they do that to protect their reality. Next slide, please. So where we hope most people are at now, but as you know, as Julie described and as I've described, everybody is not in acceptance, which is really a sad state when you consider how we're moving into some more closures. But acceptance is where we want at least people to realize, okay, COVID is here. It is real. It is a problem in Minnesota. It's impacting. I need to change my life, or at least the short term here, to protect myself and others. And they need to be able to acknowledge that there is a new reality going on because of this disaster. The question that most public health workers really have right now is, how can we get everybody to a stage of acceptance? We've been struggling to do that for months. And it's not something that we can do. I firmly believe that it's impossible for us as public health to do it, because we need to get everyone to trust inside the government, because we are the government. People see that. They see us as the people putting restrictions upon them. Whether it's us as workers having restrictions put upon us for how we can do our job, being told we have to work at home when we would prefer to be working in the office. Being told we have to also do schoolwork with our children at home where we're trying to work. None of us really want to accept these changes, and they're very difficult for us, and they put a lot of strain on all of us. But one of the things that can help with this, and there's more and more people speaking out with this and more tools being developed by this, is have people who are key figures, whether they're key figures as popular movie stars or social media stars, or they're people within the community speaking out about how COVID-19, how masking is important, how social distancing is important, and to really stop and counterattack the conspiracy theories that are out there and the disgruntled people of not wanting to follow some of the advice, the public health guidance that we're putting out. What would be great is if we could have all of our leaders and have some real consistency across the United States on the messaging we're providing. That doesn't appear to be happening. Right now, I guess the best that we can hope for is we continue to do that here in the United States. I'll give you some examples later on of some messaging that is also positive that's working with us in the resources. So next slide. The other thing I feel that it's important for us to address is caution fatigue. That term fatigue is being thrown around all over the place during this disaster. We talked earlier about compassion fatigue, which is the result of burnout, which is a clinical disorder, that is the result of burnout and secondary trauma. Caution fatigue is what we're dealing with in people who are not following the rules as strictly as we like. We had, as Julie mentioned earlier, we had people initially following our guidance and really doing some masking and following the social distancing, and that has fallen away a lot in certain areas. So caution fatigue is not the same as information overload. Although COVID fatigue, that's when we're talking about information overload, and we're all suffering from COVID fatigue. Everybody's getting sick of it. Even people like Julie and I who are used to dealing in disaster response, this is a long response, as she mentioned. This is not something we're used to responding this long. It's not the same as alarm or alert fatigue. Alarm fatigue and alert fatigue really mean, let's say you have a really sensitive smoke alarm inside your house or your apartment, and every time you cook it goes off, and then eventually you start just ignoring it when it goes off because you earn this decreased sensitivity to hearing it. That's kind of like the cry wolf story. Caution fatigue is when someone understands the risk. They're at this acceptance part. They know that COVID exists. They agree that it's a risk, that they need to change their behavior, but they're tired of doing it. They often decide their behavior changes often because maybe through discounting. Nobody else is wearing a mask and they don't want to be the one doing it. Peer pressures is there. Or it could be that wearing a mask is developing a new habit. Managing social distancing is developing a new habit. And while this has been going on a long time, this is still a new habit for all of us. And any new habit is easy to break. Any of you who've ever been on a diet or tried to stop smoking or tried to stop shopping, or any behavior that you tried to change or tried to start a new behavior, know how easy it is to stop, to have a lapse, and then how hard it is to go back on practicing that new behavior or avoiding that behavior once you've had that lapse. And we see this happen too. Someone may always wear a mask when they're shopping and they keep their mask in their car. Actually, they should be taking that mask and washing it and putting a new one in, but that's a whole other recommendation. But they keep it in their car. They forget one time and they get all the way up to the grocery store doors and they don't have their mask. And they have to stop and think, and they realize, I don't have my mask. They see somebody come out with a mask on. They need to stop and think then, am I going to go back to my car and get my mask? Or am I going to say, I just need one or two things. I'm just going to run in the store real quick and get them. I'll just stay away from other people. If they decide they're going to run in the store, the next time they go shopping, it's harder for them to remember to use their mask. So you get that caution fatigue in your behaviors. Make it easier to avoid doing the things you need to do. So there are ways that we can do that, too, to help people deal with caution fatigue. Next slide, please. I'd like to hear, because caution fatigue is such a huge issue in Minnesota right now, I'd like to hear some comments in the chat of what you think we can do to address this issue.
While people are doing that, we did have a question come in. Dana asked, do you have any suggestions for interacting with people in those various emotional stages? Like you've said what they are, kind of how to recognize them, but what are the best steps to interact with them in those stages?
Well, first, we have to recognize that they may not want to listen to anything that we want to tell them. You may not be able to interact right now, especially because we're in such a climate of political discord, and we have a lot of people suffering from systemic racial inequality that's bubbling up. So we have those traumas that are also playing out in there. First thing is recognizing what the person we want to put this out is to recognize what's going on with those individuals. And see if you can if they are family or friends, you know them well enough to know, can you have a conversation and listen to each other's side? If you can't, then it's probably best to just wait right now, because we can't, any comments you guys have on if you've done something successful with this, right now we need to have people that can change a group mindset, because we have so many things going on, like the QAnon, we have the conspiracy theorists out there that are also putting out information. We have political conspiracy information going on. We have a lot of things that are not necessarily, it would be difficult to deal with, but you add them now with COVID in here, it makes it even more difficult. So sadly, no, I don't have a whole lot of recommendations other than being mindful of where someone else is coming from and trying to be respectful in a conversation, even when you disagree with them. Sorry, Dana.
Then Chuck said, when you're talking about caution fatigue, that the roller coaster of this crisis and response is wearing. It's one thing, if this is short term, but it just keeps going and going. Paula says they heard someone say we need to change the narrative from COVID fatigue to COVID endurance. Hillary says how to respond to people. And mentor once suggests that if you can take a deep breath while they are talking and remind yourself that you are observing their distress, but their distress is not your distress.
These are good, you guys, and I love that COVID endurance. I'm writing that down.
Dana, again, we cannot set it to chat to all participants. If we select to chat to all participants, when you type in the chat, it would be read by a screen reader. So, and if people were talking at the same time, that can be very confusing. So we have it go to host, and that's why I'm reading it out loud. And then it's one person talking at a time, and we have somebody closed captioning the call. So that's why we do not have it to all participants. And Jackie says, more stories like the nurse telling her experience of folks who are in denial at death. The sharing of stories of those seeing the impacts of denial and those who suffered COVID-related issues. I agree with that, Jackie. That was very emotional when I watched the governor's presentation. And then Jackie also said patients giving their stories. which is true. I haven't seen, there's been a couple articles, like I saw like a YouTube video, but I haven't heard a lot from the patients who have gone through this. Jim says, for me, it's my influence, my family, close friends, so I'm striving to model good behavior and encourage best practice to loved ones. And Carolyn says, I admit my patience isn't an end for people. How to deal with that? I'm with you, Carolyn. There's some of my family members that I tried to be a good role model for. So I think that's a good thing to ask, because at this point I'm kind of burnt out of arguing with them when they won't even look at science, just like I believe whatever I want to believe. Mark says, I think caution fatigue is analogous to driving through an ongoing yellow light. We need both green and red, sometimes just stopping, and other times reframing the risks and going ahead with action, living and practicing compassion, feeling how others feel, living and walking in the other shoes.
These are wonderful comments. Once again, in the sake of time, we're going to move on, but continue to put them in the chat, because we are going to capture these, and then we can share this later. But I really appreciate it, because you guys have had some wonderful comments about how we can deal with this as we move forward. I'm going to turn it over to Julie now to talk about adaptation.
Yes, and I echo what Nancy just said too. I appreciate all your feedback and your participation in the discussion. So again, this is Julie, and I'm going to continue with the emotional stages of pandemic crisis, adaptation. The ability to adapt to a new situation, a new normal. And I know that sometimes, especially with this COVID-19, it is sometimes hard to grasp that new normal. We might not be able to identify a new normal because, again, it seems like months, right? And it has been months, but again, it takes a while for us to really identify a new normal. For example, working from home, it might be, that's a new normal for me at this time. Again, for others, we're not quite there. So we have to be patient with ourselves and kind of understand what that new normal is. But a new normal does encourage the development of new skills, which enhances resiliency. A critical component of adaptation to a new situation is the practice of sense-making. Sense-making is the process used to gain an understanding of an ambiguous situation and is essential for effective crisis management. Sense-making allows us to integrate the new rules into both our personal and collective worldwide view. And so that new normal provides us, how can I work in this new reality? Next slide, please. So adaptation and sense-making during a disaster and crisis. By the time we get to this stage, we agree that COVID exists and it has impacted our lives, but the question still remains about how or if we should change our lives in response to the threat. Sense-making is another process by which we make sense out of the unknown. Disaster responders, public health, in the thick of the response, not only interprets the reality, they also influence it through their actions. So that their sense-making is not just a passive cognitive process, but an active construction of reality, building the ship while we are in it. And we've heard that several times during the COVID response. This hands-on sense-making aids in their adaptation process. It also adds additional stress, since the average citizen is not participating in this collective sense-making process. So they have a less buy-in from public health. the public health recommendations because they may view them arbitrarily. This is especially true during COVID-19, with multiple high-impact decisions are made during a short period of time. And we've seen this time and time again through our work and through local public health. So collective action is necessary to effectively respond to a crisis, but individuals and different organizations may view the situation differently, depending on their disaster response role and their in-group or organizational lens. During COVID-19, we have people and organizations looking at the disasters through different lenses, such as as mentioned before, the political lens, a financial lens, a social isolation lens, all results in a lessening of collective adaptation to public health actions because they see the larger disaster threat as something different than a public health threat. Next slide, please. And so we want to talk a little bit about barriers. What are the barriers to COVID-19 adaptation? And again, this is a discussion slide where you're able to put in the chat your thoughts. So
while people are responding to the question, what are the barriers to COVID-19 adaptation? Dana stated that the states, I'm assuming the emotional states, are good for framing individual perspectives, but we also need a system-level view. For example, what is adaptation and sense-making for unit, division, and agency-level responses? Collective sense-making requires collective transparency and communication. There has been a real failing here on these.
That's a really great way of looking at that. I hadn't really thought about that, but now that you mention it, that's absolutely correct. Thank you for sharing that.
In response to what are the barriers to COVID-19 adaptation, Amanda says politics. Jackie says lack of communication internally. Caroline says leaders spreading false information. Jenny Lee says media oversaturation of information.
I think the group has identified some great barriers there to COVID-19 adaptation, and so continue to add your comments in the chat. We will continue on with the presentation because of time. And so the next slide talks about evolution. I finally figured out this is a new reality and I can grow from it. Few individuals are at this stage because this disaster is still unfolding. There are a lot of remaining unknowns, and although we can see the beginnings of evolution in how the world can adapt to the changes focused by the virus and even how we can thrive during the post-COVID-19. More workers and businesses have discovered that they can function effectively with remote staff. Through, all of the different mechanisms that we have available to us, we can conduct meetings. We can be productive in our businesses. Businesses have also learned that they can evolve and prosper by changing how we function, online versus in person. The things to remember is that evolution brings both the potential of both positive and negative growth. It is never too soon to start promoting positive evolution and post-traumatic growth. Next slide, please. So we're going to talk a little bit about post-traumatic growth. We want to encourage resilience and post-traumatic growth. The Mayo Clinic states that to encourage resilience, be proactive. Don't ignore your problems. Instead, figure out what needs to be done, make a plan, and take action. Although it can take time to recover from a major setback, traumatic event, or loss, know that your situation can improve if you work at it. Research has also shown us that strong day-to-day systems can be better leveraged to support health resilience during a disaster and emergencies. Post-traumatic growth cannot be encouraged during the disaster when the individual or system is still under stress, because it's often too early to look at the value that may have arisen from surviving the crisis. Next slide, please. And so this is our second poll, and we want to kind of have you think about how confident do you feel that we are moving toward evolution. So take a few minutes.
While people are answering the poll, I'm going to say that Dana in chat said, you have really done a nice job outlining some of the barriers, cognitively and socially, politically. We need to move to developing better narratives that we get into the same tent. Maybe it is the testing tent. And then Hillary said, who is the, air quotes, we, MTH, Minnesota, society in general? And Jackie said, not giving explanations when things change is not giving community all the information. Thus, they fill the gaps with their own beliefs. Example, when mask recommendations change from not needing one to needing one, wouldn't it be more transparent and honest to state that we didn't want a shortage and we didn't know it could be so asymptomatic, etc., rather than just changing it without a reason? We don't behave this way in our families, or we shouldn't. And Paula also said, please define we. So it's how confident do you feel that we are moving toward evolution? So who's the we?
I would say MDH is the we. And all these comments that you shared are absolutely true. There's lots of lessons learned that we're going to have through this response.
And I think we should update that poll in the future. I apologize that we didn't find the we until the poll ended. I didn't read the question until the end. Okay, I've shared the results.
So it looks like we have some people that are somewhat confident that we are moving towards evolution. I think that the majority of people are not confident. We have one person who's very confident, so I applaud you with that. This is something that you're right. Like I said, you made some wonderful comments, all of you, and we need to start looking at things and doing things differently. Yeah, continue to make comments in the chat with this as we move forward. Can we move to the next slide, please? This is Nancy, and I'm going to talk about some resources here. First, another thing I want to point out that I see every presentation, and I keep meaning to change it, and I have not, is the second bullet point, MDH supporting mental, it should say wellness in here, and I keep forgetting to add the term wellness. So I want to show you, first I want to point out the top link here is my MDH behavioral health, mental behavioral health COVID-19 webpage. If you have not checked out this webpage, I want you to. I've got hordes of resources on here. I'm going to point out a few of them today. So let's see. First thing I want to share with you is the COVID-19 Wellness Pocket Guide. If you have not seen this, I want you to, I can send you the larger printout of it. On my webpage, this pocket guide is in here, and I'm going to show you where to find it after a little bit. but it's in the more of the fold into a small pocket size handout. So if you prefer, if you're like me and you're getting older and you want your print to be a little bit larger to read it, and you like to have a little bit larger, I can send you the PDF and you can share. So it has components in here for a daily personal care checklist. Because remember, some of the things that we want you to do is to start monitoring and being aware of your stress levels, right? And then we're going to give you some self-care tips in here too, but we're going to give you some tools right now of how to do that monitoring. So here's some tips on taking care of yourself and some reminders, for morning, afternoon, evening, some family care things. Because we know that right now, some of us are spending a whole lot more time with our family than we ever have in the past. And while that's wonderful in some ways, that's also adding incredible stress to our lives. So how can we do that? And how can we manage that stress level? And then do some checkups for ourselves. How are we feeling today? Some checks on that. And then some tips on how to deal with things, I'm going quickly over this, but you can find this. Then there's some contact information. This COVID Cares line now is now a different phone line, which I'll show you on the hotline for everybody, which I'll show you on my webpage here in a minute. And then some journal points. Journaling is a really good way of getting stress out if you don't have somebody to talk to at that time. And also if you really feel like you're not comfortable sharing what's going on with you with someone else, you're still getting it out, and then you can look back at it later and see how your stress level has gone. So then it's got some room for notes on there. So this is one. On my web page, see if I can bring it up. Gotta go to it. Journal. And you get down to healthy communities. You get down to emergency preparedness. And I actually have two web pages. I have my regular disaster and behavioral health web page. Then I have a COVID one. So there's the COVID one. That phone line that I talked about is now one for any Minnesotans. If you weren't aware of this before, I want you to be aware of that. Here for Minnesota, it's a free phone line from 9 to 9. You can contact that. There's a bunch of crisis line information. Responder resources is where I really wanted you to get to because you are responders. Everybody working at the Department of Health, whether they're actively in ICS or they're working to do their regular work to keep that going, they are a responder. And so we have hordes of tools here in our mental health and resiliency tools for healthcare responders. We have things for how to address anxieties and concerns, some tips for leaders, for those of you that are supervisors and managers, tips for taking care of yourself. There's the Wellness Pocket Guide, and I'm going to show you really quick what I meant by it's for little print in here. Where to turn for support, other tools and resources that are in here. What you may have, another tool that I really want to share with you is the First Responder Toolkit. We talked about really keeping an eye and managing your burnout levels and your secondary trauma levels for your compassion fatigue. This is right now it's a mobile web page, but it will be an app eventually down the line that we developed with the University of Minnesota. And what it does is, I'm going to show you, it gives you tools within here to do, to do self-reflection, self-care tips. You can do a compassion fatigue survey, which really looks at your burnout levels and your secondary trauma exposure. It also allows you to access a trauma risk factor survey, which really looks at your exposure to traumatic stress during this COVID disaster. It has, you can keep and you can monitor this as you go on. There's a personal risk and vulnerability checklist. Things that are going on in your old life also add to that stress, And that includes if you're dealing with major projects or responsibilities or changes with those within your workday. And then there's a variety of other just resources that are in here for you. So we want you to think about using this tool. Get out of here and go back to my web page. And then there's a variety of other things in here. How self-care tips. We developed, in Minnesota, you may be aware, some of you may have had the training. We do a psychological first aid training, and we've done this training since our Hurricane Katrina Rita response back in 2005. And we developed in the past an online training in psych first aid with the University of Minnesota, and you could go into the university and get 0.75 CEUs for it. We recently updated that training and made it accessible. You can still go through the U and get those CEUs if you need them, or you can go to the YouTube, and we broke it down into different parts so that you can just do the YouTube training too. So that's there for you, along with the self-care and psychological first aid training for COVID responders that was created with the Metro Region Health and Safety Coalition. And let's see, I'm going to show you a couple of other quick tools. We've got a little bit of time. Okay, so there was that. The YouTube videos are here. There's a variety of stuff. There's a variety of resources under healthcare provider resources too. Community resources. This is a new resource here called How Right Now Partner Toolkit that we just were told about. It's actually been out, originally a rough draft of it came out in August, but now it's more put together. And it has within it, let's see if I can scroll down here. Different links, but it also has like PSAs for celebrities talking about COVID and how it's to say, how you need to change your behavior and the importance of masking and social distancing. We also are developing within MDH and within the community liaison and partner unit, they're developing some PSAs within some of our cultural groups that will be coming out soon. So that's this resource. We also have resources, a variety of other resources for community members, some for children and parents, families. Mental health, people who are suffering from mental illness. We developed some culturally competent ones with TPT. And workplace resources. For some of you who are interested in tips for managing work and life balance during COVID, help for supervisors to help support staff during COVID. And then we've got a few different things with coping with also community violence because that's going on. So those are the ones that are on the COVID page. And we've got like another minute left if you have questions. Otherwise, I want to thank you. Let me stop sharing. I also want to let you know that feel free to contact either me, Nancy Carlson, or Julie Johnson after this. If you think of a question or you didn't have time to ask it during this, we're more than willing to answer any questions or assist you with anything following this too.
This is Julie again, and thank you so much for spending some time with us this morning around this important topic. Have a good day, everyone. This ends our webinar.